Your liver is a large and powerful organ that performs hundreds of essential functions in your body. But what happens when it's diseased and doesn't work correctly? We're checking in today with Dr. Ujjwal Kumar. Dr. Kumar is a hepatologist and gastroenterologist at Mercy's GI Clinic. So, Dr. Kumar, thanks for joining us today.
Thanks for having me here.
Where is your liver located in your body and what does it do for you?
So liver, it's a solid organ. It is on the right upper side of your abdomen. And it is one of the most essential organs compatible with life. It has bile acid production. It detoxifies your medications that you take. It is involved in protein synthesis. It is also involved in regulating your blood glucose. Overall, what I generally tell my patients, think of liver as one of the main processing plants of your body, in which almost everything passes through the liver so that your body can utilize it better.
And it can be damaged in multiple different ways. Can you talk about that a little bit?
Yes, it can be damaged naturally because the way it is structured and the way it is functioned, it is exposed to a lot of toxins. Your viruses can damage it, like hepatitis A, B, C. Fat in your liver can damage it, and fat can be from multiple things. Alcohol can damage it. Sometimes autoimmune conditions can damage it. Sometimes genetic conditions can damage it, to name a few.
Let's talk about fatty liver disease, maybe something that not a lot of people are familiar with. What is that? What causes it?
It is associated with metabolic syndrome. It has a certain amount of fat which is damaging to the liver. Predominantly, few things like alcohol can cause fat in your liver. Your lifestyle diseases like metabolic syndrome, sometimes some medications can cause fat in your liver. When we talk specifically about fatty liver disease, we have to rule out other things that has caused damage to your liver.
Well, how would a person know if they have this?
Most of the times people don't know that they have fatty liver disease. Sometimes it is picked up incidentally on routine tests, and they go for their routine tests and they realize, hey, my liver numbers are slightly abnormal. And then they further investigate. Then, okay, that could be fatty liver disease. They may have advanced liver disease, and that is the first point of contact. And then that is when we work in the reverse order and try to figure out what is the cause of that advanced liver disease. And then we try to figure out that if it is fatty liver.
So there are some things that you can do to reverse that condition.
I have to explain that liver is a very, very, very resilient organ. It can get damaged, but it also repairs itself, partly. But sometimes there's a lot of scar tissue. Now, these scar tissue generally manifests in fibrosis of your liver. Now, until a certain point, this can be reversed, but after you have attained cirrhosis, then it is slightly more challenging. So, generally, the old adage is the things which is causing the damage, you remove that, and the liver gets better.
So you're talking in part about lifestyle.
Yes.
Types of things.
Yeah.
And what would some of those be?
So I have to talk a little bit about the American lifestyle and the American food that we eat.
Not good, right?
It's the kind of processed food that we eat, the amount of alcohol content that is normal to our lifestyle, the amount of soda that we drink. All of this contributes to development of metabolic diseases. Along with that, you also have sedentary lifestyle. That is where things get difficult. A few things that people can do is, one, be conscious of what they're eating. Obviously, avoiding soda at all cost. And be careful with being a little more physically active.
Just getting up and moving, I presume, would be a first step.
Yes, and weight loss, it's a comprehensive plan. When we talk about the mainstay treatment for fatty liver disease is lifestyle modification and weight loss through lifestyle modification. And weight loss can be attained with food, what we eat, along with regular exercise. What is recommended is Mediterranean diet. And Mediterranean diet is not something very fancy. It just requires us to be more conscious about what we're eating in terms of avoiding having more vegetables, avoiding processed food, limiting your dessert intake, having lean meat and fish, and about 45 minutes of exercise. But that roughly is about 2 to 5 miles a day, 5 days a week, and that's all. The goal weight loss is about 1 to 2 pounds a week. then we have seen if you have lost about 10 to 20% of your body weight, we have seen a reversal in fibrosis.
So it can go a long way.
It can definitely, yes.
Thanks for joining us today, Dr. Kumar. If people want more information, they can go to mercycare.org/GI, and appreciate all the good information today. I don't think a lot of people know a lot about their liver, including me. So thanks so much.
Thank you.